I'm Stephanie from Onward Philly, and in this video, I'm going to show you how to screen for your hip extension mobility. This becomes important in gymnasts as we pass through the split position a lot with leaps or skills that require us to go through the split position like back handspring step outs. It can even impact one's ability to hurdle into our tumbling. So first, we want to screen to see if we have the soft tissue mobility in our hips to reach that hip extension position. So we're going to see if our hip flexors are flexible enough. You will need either a stack of panel mats or a block, something that your leg can hang off of. You're going to go right up to the edge of the surface that you choose, lie on your back, and hug both of your legs. For the leg that you're testing, you're going to let that leg drop, but keep a nice tight hug on that leg that stays up. From here, you're just letting your leg completely relax, and what you should see is that your knee lines up with your hip in a nice straight line. The other thing that you want to see is that your knee has about a 90-degree angle in it. So that would mean that your hip flexors and your quads have the soft tissue mobility to reach that hip extension. Some positives in this test are if your knee is hanging above your hip, or if your knee is kicked out and is unable to bend when you're fully relaxed. You just want to make sure that your back is nice and tight here, because if we let that arch, then we can get a false positive there. If you were able to attain that position and have your knee equal up to your hips, or have that 90-degree bend in the knee, then you pass this test. So the next step would be to see if you have the strength to attain that position. And so we want to assess the strength of our hip extensors in the back of the leg. You're going to use that same surface, but this time you're kneeling onto your knees, and we're going to kick one leg out. From here, you're just going to try to lift up your leg, and your ankle should line up with your hip. So if you are unable to attain that range of motion, then there is a strength deficit that is inhibiting you to reach that hip extension, which could affect your leaps from being 180. Again, you just want to make sure you're not compensating while you're doing this test. So things to look out for: you want to make sure you're not lifting yourself up off the table or tilting side to side. You just want to keep that nice and strict and lift the leg up. If you had difficulty with one or both of those tests, then check out our mobility video so that way you can attain that hip extension, so that way your leaps, your tumbling are at their best.